holistic radio, spiritual radio. This is achieveradio.com. Follow us on Twitter at twitter.com/achieveradio.
Welcome, everybody, to Live with Dr. Carolyn Dean here on achieveradio.com. This is Ginny Gunther, also known as Ginny Almighty, and I'll be your host tonight, too, along with Dr. Carolyn Dean.
Phone lines are now open at 602-666-6027. That's 602-666-6027.
Taking your phone calls from around the world and right here in the U.S. Welcome, everybody. It's Live with Dr. Carolyn Dean, another glorious Monday evening, or it could be a Saturday morning, or it could be a Thursday afternoon. It just depends. You might be listening to the archive, but those who are with us live right here, right now, know it is Monday evening, and once again, we are here with Dr. Carolyn Dean, celebrating all there is to celebrate about finding the nirvana that we have found in a thing called the complement formulas and in a person that we call Dr. Carolyn Dean, who is the, the agent provocateur of the most amazing complement formulas on the planet that produce these kind of results. This is what somebody just sent us this week. I have been taking Remag for about a month now. I started out very slowly and have just reached about 2 caps a day. I am truly amazed on how good this product works. Over 3 months ago, I was diagnosed with type 2 diabetes and high cholesterol. I've just had my 3-month checkup with the doctors, and I'm so happy to say my cholesterol has gone down 20 points, and my A1C went from 6.1 to 5.4, which I have never seen it get that low before, ever. And then she just goes on to talk about how amazing her life is, and she's so thankful she found the products and is so grateful for Dr. Carolyn Dean. And that's what we do every night, people. Here on Monday evenings, we just all huddle up together, and we celebrate the fact that we do not have to live in a situation where drugs and surgery have to permeate our lives, take over our well-being, hold us hostage financially, and threaten every single thing that we know, including symptoms and side effects of the unknown results that come from taking drugs and surgery. We can live healthy, happy, gloriously, deliciously, wonderful lives because we have the complement formulas, which, again, have been created by Dr. Dean. I'm going to bring her on this evening, but before I do, I just want to remind you that Dr. Dean has been in the forefront of health issues for almost 40 years. She is not only a medical doctor, but a naturopath, an herbalist, an acupuncturist, a nutritionist, an intuitive, a lecturer, a consultant, an author, an inventor, as I just spoke of, and a purveyor of common sense. And boy, I think that's probably the biggest one. Oh, well, her technical qualifications are pretty impressive, too. And she's got a great sense of humor. And she's very pretty. And she's fun to hang out with. All right, we're so happy to have her this evening. Welcome, everybody, Dr. Carolyn Dean. Oh, wait a minute.
Yes, Ginny, I will not appear without the yay. It gives me that extra 3 seconds to unmute and say, yay, back to you.
Yay.
And thank you very much for another rousing introduction. And yes, that Facebook testimonial is pretty awesome. People just land them on our desk all the time, and it is great. It reinforces us to keep doing what we're doing, and it certainly reinforces people who read them to think, well, maybe I'll just try, because there's still even people listening to this show who are not taking Remag and don't know what they're missing. But one of these days they're going to try it, and they're going to be so excited. We have Ginny's blog to to go into and a whole raft of emails. It's about kidney disease, magnesium deficiency calcification, and kidney disease, and it garnered a lot of interest. So it seems there are a lot of people out there with kidney disease. But first I wanted to talk about sex. I had this email got pushed further and further down. I said, no, I'm going to mention it at the outset. I did give this testimonial on payday the other day, and it's a woman who says, I have to tell you something that REMAG has done for me besides stopping heart irregularities, which is big enough in itself. And as this is so personal, it's not something you want to tell anyone. But since it's you, exclamation, smiley, for a number of decades, I was unable to make love with my husband due to an episiotomy scar right up to my cervix. And that you get an episiotomy when you in childbirth. So they had to make an incision to release the baby, and the scar went up to her cervix and caused the inability for her husband to penetrate, and pain as well. Anyway, after a year or more, as I can't remember when I first started REMAG, using half a teaspoon of water every evening, I've been able to make love for months now, to our mutual great delight, as you may imagine. And I'm 71 years young. I wonder how many other women have experienced this phenomenon. I wanted to let you know this for quite some time, but actually been embarrassed about saying it in other formats. Aloha. And I just right away emailed her back and said, what an awesome story. You can be sure I'll bring this up on my next radio show. I've had women tell me they've been able to achieve orgasm on REMAG. I think in your case, REMAG took care of the pain, relaxed the muscles around the vagina, and likely helped dissolve calcium that may have been in the episiotomy scar and up to the cervix. And then I did an LOL, all that with only half a teaspoon. Just think what more would do. So what do you think of that, Ginny?
I think that's amazing. It is the unforetold aspect of what magnesium can do, what the complement formulas can do. And this is why we say get on them, stay on them, and don't give up, because what an unexpected thing, but what a beautiful surprise.
Right. Yes, it looks like she was taking them for her heart irregularities, and then, boom, all of a sudden after a year this happened. And she knows it's due to the REMAG. It's awesome. Okay, yeah. So very, very cool. Then diving into your blog. So Ginny writes, and yes, she says, she'll take excerpts from different areas, and it does look something like what I've said before. If you don't have enough magnesium in your body.
Carolyn, wait a minute, I just have to tell you, this is your blog. This is your blog I just wrote. Yes, this is why it looks so familiar. Yes.
Oh, it looks familiar, okay. So here's Ginny repurposing words that I seem to have written in the past. And I guess I just started to get really frustrated about kidney disease. It seems to be rampant, and doctors don't do anything to heal the kidneys. What they will do is tell you, well, because your kidneys aren't filtering properly, you're going to be subject to hypertension, heart disease, cholesterol, and they'll try to put you on blood thinners, antihypertensive, statin drugs to prevent you from developing these other conditions that will come out of kidney disease. So they don't treat kidney disease at all, and they do scare you. But anyway, this is what we're talking about. If you don't have enough magnesium in your body to help keep calcium dissolved, you can develop many symptoms: muscle spasms, fibromyalgia, neuralgia, calcified arteries, dental cavities, calcium deposits, including breast tissue calcification. Some researchers equate aging with calcification. I mean, there's a prime reason right there to take your REMAG. A recent study found that elderly women who take calcium supplements and had a history of stroke or white matter lesions in the brain may face an increased risk for dementia. And remember, elderly means anyone over 65. Another scenario plays out in the kidneys and bladder. If there's too much calcium in the kidneys, not enough magnesium to dissolve it, you can develop kidney stones. Calcium deposited through the bladder can make it rigid, lower in capacity, lead to frequent urination and leaking. A 2015 study confirms magnesium's role in dissolving calcium crystals in artery calcification. That's your atherosclerosis that leads to hypertension. And then when it happens in the coronary arteries, it leads to a heart attack, and then the heart bypass surgery, etc. This 2015 study focused on aortic valve calcification at a time when there's been a huge increase in heart valve problems. Kidney artery calcification is common in chronic kidney disease, but it's been neglected because it can't be treated with stents or artery bypass, as is done in the heart and in the neck. In the neck, carotid artery calcification, they'll especially do stents. Drug therapy is all that's left, but drugs are not used to treat kidney disease. Drugs are given to prevent the diseases that are commonly associated with kidney disease, as I've already mentioned. To add insult to injury, anyone with any level of kidney disease is told to avoid magnesium. That's because patients with no kidney function who are on dialysis can build up high levels of magnesium if they're given IV magnesium. Those cases led to detrimental advice that you should avoid magnesium if you have any level of kidney disease. So that bit of advice comes out of doctors just not knowing about the need for magnesium, first of all, in the kidneys, and taking that experience with IV magnesium in dialysis patients and putting it across the board. So that's been horrendous. Millions of people have been told to avoid magnesium on that basis. And then in the blog, we put a customer testimonial. Kidneys no longer failing. I thought I would give an update on my health and my renal failure, which was cured in about 4 weeks. And I believe my numbers will continue to improve. I'm 69 years old. This is a male, weigh 185 pounds. I'm not diabetic, have never smoked. I exercise regularly, have no history of kidney problems, no family history of kidney problems. I did take proton pump inhibitors for a very long time and blood pressure meds since I was 25 years old. I suspect that proton pump inhibitors had something to do with this. Yes, the FDA black box warning on proton pump inhibitors says that it depletes magnesium. I just took a drink of my sea salted water. So, and certainly the blood pressure meds will deplete magnesium. My doctor says all medications have side effects, like, of course they have side effects. Why wouldn't they? And he said he'd keep a close eye on my blood test to see if there's anything he could do. He can't do anything. My creatine blood level started to go down last year, and he might mean his glomerular filtration rate because, you start building up creatine in the blood when your kidneys can't clear it, and then the glomerular filtration rate is a ratio that's determined by your age, sex, all kinds of not that many different things, and your creatinine levels. So I looked long and hard on the internet for naturopathic doctors that had an answer, and yours was the only one that made sense to me. Fixing things at the cellular level was my convincing key. I remember my biology way back when, and magnesium was the key to life. I can't wait for my next blood test in another 4 weeks. If it keeps going up that fast, it should be back to normal. Glomerular filtration rate is supposed to be at least 60 and, up to think is 100 is probably excellent. So if it drops, then the kidneys aren't filtering as fast or as well as they should. Let me see if I have words on that. Right. I've got so many things open here. It's crazy. No, I don't have anything. I'll be looking as I speak. So I say, instead of expensive and disruptive IV chelation therapies, you can be in charge of dissolving your own calcification. A customer wrote the following. My wife had open heart surgery 2.5 years ago, due mostly to hypertension and obstruction of the coronary arteries. After being on Remag and Remite for several months, her blood pressure dropped from 180/95 to 110/60. Also, her ejection fraction for her heart improved to 60%, and the last ultrasound of her carotid artery showed a 30 to 40% lessening of calcified occlusions. And I have written a blog about kidney failure is doctors failing to properly treat the kidneys, and it does seem to be becoming almost epidemic. And what I wonder is happening, and it'll come from an email in a minute. I think they're tightening the criteria of kidney disease, or expanding the criteria, I should say. With cholesterol, they tighten things up and say you have to be 180 to 200 now, whereas when I went to medical school, the average cholesterol was 245. I think they're widening the spectrum of kidney failure numbers so that they can grab more patients and put them on medication. I also think that broad-spectrum antibiotics, aspartame in diet products, high-fructose corn syrup are all affecting the kidneys and making them more at risk for kidney disease. And with all this talk and excitement, I have lost my computer, so I'm going to have to shut her down. Ginny, do you have another testimonial that you can give us right now while I have to shut my computer down and bring it back up?
Oh, dear. Okay. Sure. And I want to just say we do have some great testimonials that have come in, too, on the restructure. And, Carolyn, I wanted to also say that I was amazed at how many people did respond to the post today. So I do think that this is a big topic, for sure. All right. Now, where is my restructure testimonials? Hold on just a second. I have to be scooting around and finding things, too. I just sent them to our good friend Sheila. She is helping me put together a brochure. Where's the restructure? Oh, dear, computers. Okay. Let's see. Is this it? No. Gosh. Where is it? Okay. There we go. Let's see. I started giving Restructure to my children. I made them smoothies in the morning before school. They loved it. They always know when Mom doctors their drinks. Not this time. Restructure integrated into the smoothie so wonderfully. There was no funny vitamin taste, no chalky residue, and no smelly good-for-you aroma. I benefited those mornings, too. I sent my kids off to school knowing that I had just given them the ultimate nutritional start to their day. Thank you. I thought that was really sweet that people are giving it to their kids because it is so beneficial, very wonderful, and they're, bridging out and looking at different ways to use it.
Yeah, it is amazing. I want you to keep going. I have a real problem here, and I can't get to my files.
All right. Well, I will keep going then. All right. So what I'm going to do is let me just read through a couple of the blogs that you did this week, okay, Carolyn, that are on your Facebook page.
Or even what we could do, since we're entering the kidney failure business, if you could ask some of the questions that got sent in today about the kidneys, and I can answer those.
Oh, okay.
Stay on topic.
Sure. Okay. Very good. All right. Very good. Okay, here's one, and I don't know how many of these you've already gotten, so I'm just going to have to go through because, Melody Rose does a lot of those for you. But we'll just swing it, and here we go. Let's see. Where are we here? I bought Remag for my mom, and her EGFR is 50. Is it okay for her to take it, and will it improve her EGFR? I have a 7-milliliter size kidney stone. Will the Remag help dissolve it? How many milligrams of Remag will I need to take to dissolve this kidney stone I already have?
Right. So that's two questions. As I mentioned earlier, GFR, glomerular filtration rate, is supposed to be at least 60. Her mother's is 50. What we heard from the gentleman who gave the testimonials was his GFR was starting to get lower and lower, and then it started to come back. So it's not just a matter of the Remag, though. I really think when you're dealing with something like kidney disease and you're being threatened with, a handful of drugs, etc., I think it's time to do everything, pull out the stops and do Remag and Remite, do your Realign for detox, the RNA drops to build perfect cells, do even the Restructure. We call it a protein powder, and I know they tell people with kidney disease to restrict fluid, restrict protein. I mean, everything is restricted. There's one email that might come up. Someone's asking if she should go on a vegetarian diet with her recently diagnosed kidney problem. And I think that our Restructure protein powder, it's 11 grams per serving. Some of the bodybuilders said, oh, that's not enough. But what we have found with people who've had gastric bypass and with people who really know their bodies and know their protein, the protein that we're giving is so well absorbed that it makes people feel like they've had a full meal. They don't get hungry. They feel supported by it. So just like we're doing with the minerals and demanding full absorption from them, that's what's happening with the Restructure. You're fully absorbing your protein so that it's not hanging around doing other things and, building up and causing problems for your kidneys. I know that I'm kind of being a bit facetious there, but telling this woman that her mother would do well to be on all the complement formulas, including the Restructure and the RNA drops, and get her to read some of the information. I've in my files here, I'll be sending it to Melody Rose and Ginny, and you can cut and paste from my 2012 edition of the Magnesium Miracle, where I really make the case about the kidneys really needing nutrition, and try to give people some understanding of how it got to be that first of all, kidney disease is starting to be more rampant, and secondly, why magnesium has been called a problem in kidney disease. There's even a section in the 2017 Magnesium Miracle book where I talk about a kidney researcher who worked with a magnesium researcher. I know the magnesium researcher, and they did ionized magnesium testing and serum magnesium testing on a group of kidney patients, and found out the serum test had no correlation with their kidney disease. In fact, it made people with kidney disease looked like they had high serum magnesium, but when they tested for ionized magnesium, that was not the case at all. So people, again, have been misdiagnosed with high magnesium, and that's been untrue or whatever. So the kidney patients who were tested were then put on an ionized oral magnesium supplement, and it seems that most of them, if not all of them, recovered kidney function and lessened their symptoms. I mean, I haven't read this study lately, but that's what I'm recalling, and that's what I'm seeing in the people who do the complement formulas, do the REMAG. There are people on dialysis who are on REMAG, and there's one woman, she's a health professional, and she does her blood levels of magnesium before her dialysis, and after her dialysis, her blood levels of magnesium are lower. So what's happening in dialysis is they're actually pulling out your magnesium and making you sicker in terms of magnesium deficiency. As for doing magnesium for kidney stones, I mean, that's something that even allopathic doctors should know about, because it's been in the literature for years. What goes along with taking REMAG is the vitamin B6, and that is in our Realign. So, yes, go ahead and do the Realign and the REMAG. Why I say to do the REMITE as well with any sort of health condition is that if you've become deficient in magnesium, then the other minerals are likely deficient too. They are not in the soil either. And what we see happening certainly with the thyroid and the hormones is these minerals are all necessary for the proper function of the body organs and to make our hormones and to, keep the organs working properly. Do you think I answered that question, Ginny?
Yes, I think that was a great answer. Absolutely.
Okay, next one, because my computer is just, it's sitting here mocking me.
Okay, well, then we'll just keep going. Now, I want to answer, I love this question that came in early this morning. Where did it go? Come on, Virginia. Oh, okay. I just received my REMAG and wanted to know if I should start taking a calcium supplement along with it. Do you think people should supplement calcium? Yeah.
Yeah. Well, I mean, that's where we really like people to Google my name and their question before coming to customer service, because I've got enough information out there about calcium is not my friend, and the problem with overcalcification. And this is our blog today is the calcification, and it's mostly from women being told they have to take calcium for their bones, and in fact magnesium is necessary to help absorb and put calcium into the bones. And my statements I think are also in Remite. I'm updating the Remite book to be a Remite and Recalcia book because I personally can't eat enough dairy products to keep my 600 milligrams of calcium a day. So selfish as I am, I had to create a calcium product. So in that, I do talk about 600 milligrams a day of calcium is sufficient in the UK and at the World Health Organization. So it should be sufficient for us as well, instead of the 1,200 to 1,500 milligrams of dirt calcium, most of which, 96% of which is not absorbed and then ends up calcifying the body and causing aging, as I mentioned at the outset. Calcification is a cause of aging. So I think that answers that question, Ginny.
Very good. Here's the question I was looking for earlier, because sometimes people just crack me up. Okay, I've been taking the Remag and Remite for a long time. Why do I keep having medical problems? If Remag is so good, I should have perfect health. It just cracks me up. I'm like, people. I'm just recovering a heart attack that should not have happened, and I still have rheumatoid arthritis. I seem to be missing something. Also, I have swelling all the time in my lower legs and feet. I have a chronic lung disease that I believe happened when I took the rheumatoid arthritis drugs. I had to quit those drugs because my body could not handle them all. It just made me sicker. I hope I'm not blabbering too much, but I am concerned about my health.
Right. Yes, I already answered that person. I said, I'm sure you're just frustrated and you don't expect that Remag and Remite are going to cure, decades of rheumatoid arthritis, tons of rheumatoid arthritis drugs, heart disease, and lung disease. And I just said, take all the complement formulas. If your legs are swelling, you're not doing your sea salt and water. You might not be taking enough Remag and Remite. For people with chronic diseases on a lot of drugs, they're on the 3 and 4 teaspoons a day plan and the 2 teaspoons of Remite. And what else? Yes, with the rheumatoid arthritis, she would have been given prednisone. With the lung disease, lots of antibiotics. So there's yeast overgrowth. So you have to do a yeast detox to help with symptoms that can be from head to toe. We have a lot of people who start the complement formulas and then say, oh, my tongue is coated white, I'm getting a rash, I have vaginitis, my gut is all upset. Those are yeast symptoms, and your yeast they're not crying out to be killed, they're crying out to be fed. And so it's important to do yeast detox. So, yeah, we don't like to give the impression that Remag is a miracle, but it is for a lot of people. But certainly I've written and we've said many, many times that it's just not all about magnesium. Magnesium is our gateway to start feeling better, and then you start feeling better enough and you look for what else you can do to improve your health.
Hey, Carolyn, if you have problems, they should call in and talk to you, because you have an ability to find out the little thing they're not noticing. So if you're claiming that Remag and our stuff doesn't work, that's only allowed to happen if you've talked to Carolyn and it didn't work. You have to talk to Carolyn finally.
Bob,
yes.
What do you think? I talk to a couple hundred people a week, and I always try to encourage them to call and talk with Carolyn. But, people they say that the fear of the microphone is even more fearful than people have a fear of death. And people think when they call into the radio show, they're going to be on the radio, they're going to be talking on a microphone. Why don't you give me something to say to these folks that might encourage them to break through their fear and call and talk in any way?
Well, it's best to read a little bit of Marshall McLuhan and realize how devastating to the physical body the electric environment is. It is more powerful in its effect on people personally and collectively than any environment's ever happened before. And so people, they need to look at that environment, read some description about its effect to realize that's what they're afraid of. Their fear is justified because they're a fish swimming in new water and they don't understand it. If you look at it, then you might relax and realize, holy crap, everybody's on the media. Nobody can pay attention to who anybody is, so I am a nobody when I get on the phone, and will remain a nobody. There's a naivety based on not realizing the electric environment swallows the whole world. You still think you're walking around the world and operating with what you can see. You can't see the electric effects. So you do need to get into Bob knowledge, study McLuhan, and he's the best at describing this. He was the first. And then you'll see what you're unconsciously afraid of. And you'll realize you're basing it on factors that don't apply. Your physical life is not involved in the electric environment. It's a new kind of physical thing. So people are sort of instinctively afraid of it. And not for the conventional reasons. So if they figure out that the conventional reasons aren't what's involved, then they say, oh, that's what's making me think it's self-conscious to get on the media. Then you won't be self-conscious. You have to realize people can't remember anything they hear in the media anyways. They're not going to remember you. Look at Donald Trump. The guy said, I could murder someone in front of my penthouse apartment and they'd still like me. Because he's riding on electronic effect. He understands. He's been in that world for 15 years. And he knows that people can't remember. Yeah, there are a lot of people saying, well, Hillary's going to win the election because of Trump's been embarrassed over the last few weeks. He's ahead in the polls. And so the average person who thinks normal humanist platitudes apply here don't. There's other things going on. So that's why my kind of information is an important part of medicine, understanding what this new environment caused.
That's why I called on you for an answer, Bob. Very good. Thank you.
All right, you're welcome.
Carolyn, should we take some phone calls? Speaking of people who aren't shy, I know one guy who's not shy.
Okay, yes, we can take calls. And if you can take notes of the timing of things, my computer is dead to me. It is no longer my friend.
Okay. All right. Very good. All right. Well, let's go 602.
Your computer broke, Carol?
Yeah.
We're going to the store today? Yay, we're going to get a new computer?
No, Rick's coming tomorrow, as it turns out. I think my computer got wind of it. Okay, over to Ginny.
Very good. 602-666-6027 is the phone number to call. Talk tonight live with Dr. Carolyn Dean. Again, 602-666-6027 is the phone number. And when you get on the phone, you just have to hit *5 on your keypad. *5 raises your hand and lets me know you have a question or comment. Otherwise, your phone will remain on mute and you won't be able to speak with her. So *5 to raise your hand. And let's go to the great state of North Carolina, area code 919. Roman, you're on the line. Welcome.
Hey, Dr. Dean. How are you doing?
Well, I'm doing pretty good, Roman. My right arm has been cut off because my computer is frozen, but I'm happy to hear from you. You will take me out of my funk. What have you got to say to me today?
Well, I just wanted to call and give you a little update. I think that my AFib has gone into almost total remission. The only heart issues that I'm having now is if I get excited and I secrete a little bit of adrenaline, I will get some PVCs. But the AFib now, I had gotten it down. If I did get it, it was like an hour or two. And now I seem to be just, if I do get it, like a 5 or 10 minute or 15 at the most episode. So I am doing a lot better with that.
That's great. Remind the listeners, how long had you suffered with AFib symptoms, Roman?
I have had arrhythmias since I was 18.
Right.
And then I had a full-blown AFib attack about a year and a half. It's almost been 2 years now. I kind of lost track, but that time I did not. I never knew it was AFib. I would have these runs of tachycardia, but I would always revert back into normal rhythm. But that time I did not, and I wound up in the hospital with a 230 beat per minute rate. And of course, they never mention anything about magnesium or any of the good things that I should be doing with my diet. They basically gave me beta blockers and sent me out the door. I was in the hospital for 3 days, and they told me to take an aspirin every day, which I did, but it didn't get any better. And then, of course, when I read your book and been on the Remag for over a year, and Remite, and I do some of the RNA drops. And I purchased some of the Restructure from you guys. I ordered that, and that has been absolutely amazing. I've noticed a lot more energy. My skin has gotten a lot softer for whatever. I know it's because of the Restructure, because I think there's RNA. If I read it correctly, there's RNA drops, powder in the Restructure. So that has been a really big help. Two other things I wanted to mention to you and get your opinion on. About 4 years ago, I had a CAT scan done of my abdominal area. And I just happened to look over some of my old medical records on my app, and it showed that I had some calcification. They called it coronary artery calcification, but in the aorta, it wasn't the heart that they it was my
aortic calcification. Right, I know.
Yeah. And I read that. And I said, you know what? No wonder I got AFib, because I had these calcification issues going on in my body. I was literally calcifying myself because I wasn't getting any magnesium. And I also showed on another scan that they did on my heart, not a CAT scan, but the echo that they did, I had very mild left ventricular hypertrophy.
Hypertrophy.
Yes, ma'am.
Well, that's with your heart was working hard to push through the various blood vessels with calcification. Well, it'd be interesting if you ever repeated those tests, because like I said earlier, the woman who was on Remag and Remite, her husband wrote in and said on a repeat ultrasound her carotid arteries were 30 to 40% less calcium, and that's what magnesium will do. It'll help dissolve the calcification. And I was going to ask, have you been back to a doctor? Have they put you on the monitors and told you that you don't have AFib anymore?
No, they have not done that. I know from my own, I monitor my heart on a regular basis, and I know that I haven't had an SVT attack in almost a month and a half, and before that it was like 4 months that I didn't have one, and it terminated very quickly. And now my main problem, I think I've gotten mostly rid of the AFib, knock on wood, and now it's mostly just PVCs if I get excited or adrenaline has that effect on me. But I am loading and unloading my truck. I think, Dr. Dean, that longer on the Remag, I hit it every day. And every month to a month and a half, I've noticed more and more improvement. I really do. It's like peeling the layers of an onion. It's very slow. But and
that's what I appreciate about your story, Roman, and we tell it a lot, and I write about your story because you have the patience to stick with it. Even in my own medical mind, I'm thinking, oh, Roman, he's got too much adrenaline pumping, what could we do? And it's like, no, just he's healing. What are you, 52 now, Roman?
Yes, ma'am, 52 in November. I have a birthday on the 24th.
Right, so I knew you started off with us at age 51, so I figured it was close. So you've been that long, with your heart being out of balance. So we cannot expect to medicate it all away. And for you to be in charge of taking your completement formulas and seeing and noting the improvement and slowly realizing you're getting better, I think that's a real lesson for all of us, because in the anxiety booklet that I just wrote, it'll be out soon, I talk about the young woman who just kept thinking, well, I'm only 75% better. I want to be 100% better now. So she kept looking for solutions, which kept giving her more side effects because, doctors will respond to you if you keep pushing them for, help me, I'm desperate. Well, try this, try that. And the more you go to doctors with that kind of mental attitude, the more they're going to just medicate you. That's all they can do. They don't know how to do anything else. And there's a part of the doctor training where they do want to help folks, but they're not given the tools. It's just criminal how they're not supplied with the proper tools to help people. And then you read articles about physician burnout and how doctors are dying of cancer and heart disease at the same rate as their patients. So, they're not helping anybody. But anyway, yes, I appreciate you doing this slowly and gradually, and you're healing your body and your heart. And I'm glad you're on the Restructure too, because yes, you're getting a really good absorbable protein, and you're getting some extra RNA as well.
Yes, ma'am. I still watch my calcium intake. I can have a little bit of calcium, but if I try to eat a little bit too much, I will get. That's the only other thing that will cause me PVCs and anxiety. So I think, Dr. Dean, I was on antidepressants, antipsychotics for the depersonalization and stuff since I was 18, and I think my magnesium levels were just plus. As a child, I almost died a lot of times. I had pneumonia continuously when I was a baby, and they thought I had cystic fibrosis when I was very young, and I was pumped with antibiotics all through my childhood, and I really believe, after reading your materials and you helping me so much, I really believe that my magnesium levels have always been critically low. I think I was drugged out of magnesium, and plus the diet that I had, the typical Western diet, I never replenished any of that, and I think it just made me a walking, over time, calcification. I mean, and plus the other health problems that low magnesium brings. But I am so optimistic about the future, and I feel so much better. The depersonalization there's some days that I don't even have it now. I've progressed to that level. Right. And I am so thankful for your products, your book, you helping me on the phone. I would have never imagined during my whole life since I was 18 that I would have a chance to feel as good on some days as I do now. And it's only getting better. It is a slow process, and I'll tell anybody out there that was in the shape that I was in, Remag is not going to cure you overnight. It took decades to get in the condition that I'm in. And it's going to take me a while to get out of it, and it's slow, but it definitely works.
And you started feeling better pretty early on, too.
I did.
It gave you enough confidence, to stick with it. And Roman, we've never had a consultation. He's only talked to me on the phone and gotten all this help because he diligently took his completement formulas, called in every couple of months. I mean, it's been awesome how you've managed your own case, taken responsibility for your own health. So again, thank you, Roman.
Well, one more brief thing I'll tell you. When I first started doing the Remag and the program, I noticed, you're right, I noticed effects immediately, like if I would try to wash my car or load and unload. I own a lighting and sound company, so I load and unload my truck. My endurance without having AFib or some kind of arrhythmia got much better. That I was able to work for longer and longer periods of time. And that effect came on immediately. That I had more endurance without having arrhythmia. Now, Dr. Dean, I do big light shows with moving lights, lasers. I have real heavy speakers. I can do a show by myself now. Okay, I'm talking a 6-hour setup and several hours to load the truck back up. And without any problems, thanks to the formulas. And I that's all I'll say. But I really appreciate everything, and I'll give you another update before too long.
Oh, thank you, Roman. We really appreciate you. Take care, and happy Thanksgiving. That's coming up sometime this year. When is American Thanksgiving?
And tell Jenny and Bob also that I wish them a happy Thanksgiving. I know they hear me here, so I wish them well, too. And thank you so much.
Okay, Roman. Take care. Bye-bye.
Thank you, Roman.
Excellent. Thanksgiving is at the end of November, Carolyn. So we got a bit of way to go, but November is Thanksgiving month, and it's always good to be thankful all the time anyway.
Exactly.
Always good to be thankful. Yep, absolutely. All right, well, let's take another call. Let's go to area code 336, North Carolina. Well, North Carolina's big tonight. You're on the line with Dr. Carolyn Dean. If you could state your name and then add your question or comment.
Yeah, hi. My name is Dan Johnson, and I'm a physical therapy assistant. And my question more has to do with the transdermal magnesium therapy. Anyways, I've been using transdermal magnesium for about a year now with my physical therapy patients, and it's night and day difference. And I'm kind of the kind of a lone wolf, with trying different things with my patients, because a lot of PTs or a lot of people in the medical world, they don't want to, if there's not a study behind it, they just kind of turn their nose up at it, right?
Oh, yeah.
So I just wonder when the rest of the medical community is going to catch on to the power of magnesium through transdermal. And my question is, what do you like to say to people and or patients when they say, well, I take an oral supplement, shouldn't I be getting enough?
Well, I mean, there's a lot there, Dan. What my personal situation with low magnesium was I had heart palpitations and leg cramps. When I tried to get enough therapeutic magnesium into me through my skin, because oral magnesium gave me the laxative effect, I couldn't do it. I got rashes, I got itching, I developed... Do you want to mute while I'm in between?
Oh, I'm sorry.
Yeah. So what I found was I couldn't get enough, and that's what we focus on here is type of oral magnesium that has no laxative effect. And it's only since I've been telling people about the oral Remag that we've been able to get, someone like Roman, who since age 18 has had depersonalization, fibrillation, atrial and ventricular, tons of medication. And I don't know if he tried magnesium before, but my point is that to get therapeutic levels, you cannot get enough through your skin. The people who are helped by transdermal magnesium, you know, they're often people who don't have really serious health problems, and they don't have very serious magnesium deficiency, so they're able to absorb enough through their skin. As for the medical community accepting it, forget it. It's just not going to happen. We never learned it in medical school. They still don't learn about magnesium in medical school. If you tell them, oh, do Epsom salts baths, and this, oh, yeah, my grandmother used to use that. But, yeah, that's okay. But in transdermal, it isn't probably as scary to doctors or even patients as taking something orally, because you'll have someone on half a dozen drugs and you tell them to take an oral magnesium and they're afraid it'll upset their drugs. But if you say, well, put your feet in an Epsom salts bath, then you're okay. So anyway, that I have a lot to say about transdermal magnesium. What we do with the liquid Remag is get people to spray that on their joints or areas where they have pain or inflammation, and I find that the Remag absorbs better. It's not as itchy or irritating as the magnesium oil transdermal. Back to you, Dan.
Would you, can you hear me?
Yeah, you're back.
Oh, hold on. Okay. I've read where the Dead Sea has the highest concentration of magnesium out of any body of water in the world. Is that is that true in your eyes, or is there a better source, or is there many very good sources?
I don't know. I haven't really compared. All I know about seawater is that there's 3 times the magnesium in seawater as there is calcium, and that's important to me. What they do to make magnesium salt is just... we're up to the hour. We can continue on if you want to hold after the break. Okay, Dan?
Okay, thank you.
All right, we'll be right back live with Dr. Carolyn Dean in 2 minutes.
Psychic radio, holistic radio, spiritual radio. This is achieveradio.com. Follow us on Twitter at twitter.com/achieveradio.
They will call. They'll say, oh, the toxicology report came back, but then it's going to cause questions. They're going to have to ask, and they're going to want to research, and they're going to know what this is. And then they're going to say, what happened? You were Rh negative. Now you're no longer Rh negative now. Now they cross-type your blood, and they can't cross-type your blood. Then you have the strangest, weirdest A negative ever. But there is no negative anymore. It's going to be a little more of a thing. So let's go with this just like this for today. Once this starts and becomes normal, then they'll say, oh, okay, we've seen this before. This is blah. They'll say this is it. But here's what they'll call it. In the mean, Bob's in the mean business, they will call this. They'll say, oh, you have the toxicology report came back, and you have what we call is ascended blood. It's a disease. It's a disease. It's anything that's not normal is a disease. So you will suffer from ascended blood, and that's what they're called.
My wallet.
We return now live with Dr. Carolyn Dean, along with your host, Ginny Gunther, here on achieveradio.com. Skype us at ar.call.in. That's ar.call.in.
All right. Welcome back, everybody. Hour 2 of Live with Dr. Carolyn Dean here on achieveradio.com. Our feature topic being kidneys, calcification, and magnesium supplementation. But we have so many more things to discuss besides that, including our caller here from the North Carolina area. Dan, on with Dr. Dean. Welcome back, you two, and you may proceed.
Yes, Dan, you were asking about Dead Sea compared to others. I guess basically when they get magnesium salts out of a compound or out of a seawater, whatever, they concentrate it to a certain level no matter where it comes from. I mean, I don't think people are putting Dead Sea salts, although they sell Dead Sea salt for your bath, but to make a magnesium compound, they just concentrate it, and then you have your magnesium salt. You put that in distilled water. You solubilize it until it looks like an oil. But like I said, I found for myself that it was too irritating. So I looked for something that was less irritating. But, there's absolutely nothing wrong with what you're doing, and it is effective, but doctors aren't going to accept it unless they get sick enough to use it themselves. And in your position as a physical therapy assistant, you can't prescribe. You can tell people to soak in an Epsom salts bath or something like that, and that's within your practice rules. But you wouldn't be able to tell people to take oral magnesium.
No, and I wasn't at all. But my little rhetoric was, well, when you take an oral supplement, your body likes to, digest at least 50% of it out. So,
Well, but that's not the case. You haven't looked at my Remag information then, because the Remag, the way it's produced in a picometer size as a stabilized ion, is 100% absorbed at the cellular level, and that's what makes it so effective. And even when you have someone do a lot of Epsom salts in a bath, they can get the laxative effect. So it's not fully absorbed as you would think. It's just takes a longer time to absorb through the skin and into the body, and some of it gets into the cells, and the rest either goes out in the urine or out in the bowel movement.
Would a good plan of attack with your Remag, not only taken orally since it's 100% absorbed, would you recommend them using it transdermally also, or more just orally?
Well, it depends on, if a person wants to have something on their skin. I mean, let's get Ginny in here. Ginny, are people amenable to putting magnesium on their skin, or, do they say, no, I'd rather take it orally? Because in my mind, it's easier just to take it orally and then you're done. Whereas with putting it on your skin, especially with the magnesium oil, I put it all over my body and I had to shower it off within after a half hour because it was so irritating. And that's 45 minutes out of your day right there. Yeah. What do you think, Ginny?
Right. Well, I mean, our customers have a combination of things. I mean, if I was a physical therapist and I was just involved with joints, muscles, movement, that kind of thing, I think it could be pretty easy to say, okay, use transdermal magnesium or something to that effect. And we have a lot of customers who do that. They use it on, swelling, arthritis, feet, back pain. I mean, I rehabilitated my whole back with Remag when I heard it in the warehouse last year. But the reality on our end is that we have so many customers who have chronic medical conditions, including AFib and that kind of thing. They're not going to get the quality or the quantity of magnesium they need in their body through magnesium oil. I mean, magnesium oils are not built at the quality of Remag. I mean, our magnesium is like almost, therapeutic, pharmaceutical grade. So you can't, rely on treating AFib that way. It needs to be in a constant circulatory, in the body, building the muscles, building the body stores, and, of course, most of the storage sites for magnesium are bone and muscle. So that involves blood flow, that involves bone marrow, these kinds of things. So I just think it's, whatever works for you. That's what Carolyn always says in every single one of her blogs. Do what works for you. But if you're not getting the results you need, then you've got to evaluate what are you doing, and should you try a different strategy or add something to the strategy that you're already employing.
Very true, very true. Well, I thank you, and it's an honor to talk to you, and I hope to become a magnesium champion as yourself. So thank you for the
You
for your
will,
time.
Dan.
You will, Dan.
You will, Dan.
You will.
Broaden your buffet. Offer every form of access to the stuff. It works, man. It's a miracle. It's a breakthrough, Danny.
Thank you, Dan. Thanks for calling in and putting up with our abuse.
No worries. Thank you. Thank you again.
Bye-bye.
Bye.
All right, everybody. Welcome back. Live with Dr. Carolyn Dean here on AchieveRadio.com. Glad to have some of our regular listeners back, like our good friend Jenny. And also I think we've got our good friend Pam from L.A. listening with us tonight, Carolyn. Always good to have her along.
Wow,
602-666-6027 is the phone number to call if you want to talk with Dr. Dean. Again, 602-666-6027, and you have to hit *5 on your keypad. *5 on your keypad to raise your hand and let me know you have a question or comment. Otherwise, you're assuming that you're here listening with everybody else. And so that is what we'll expect, unless, again, you hit call *5. Rami said, tell my friend to hit *5. Okay, I'm saying it *5 on your keypad to get into the call. All right, let's see.
Hey, Ginny,
Carolyn,
check your mic. Don't you find her a bit low, Carolyn, for some reason?
Yeah, maybe you slipped away from your microphone there, Ginny.
Okay, am I back?
Yeah,
okay?
That's good.
Okay, very good. All right, so let's see. Carolyn, would you like to do some more emails?
Yes, if you wouldn't mind. Again, I'm both my hands are cut off now, so I can't do anything.
All right, very good. Well, we'll just go along this route then. Okay. So let's see. This one says, I started using the Restructure powder in addition to the rest of your complement formulas. If I'm trying to avoid a calcium intake, should I be concerned? I had a calcium score test almost a year ago, and from the test results and my family history of heart disease, my doctor wanted to put me on a statin. I reluctantly tried it for 2 weeks and felt terrible. I decided to stop after doing research, and that's when I discovered you. How would you compare the amount of RNA powder in the Restructure to the regular RNA drop? Thank you so much. I always look forward to your weekly show.
Yeah, that's interesting. We really don't know. There's the comparison. There's 13 milligrams, little pinch of RNA powder. We say one drop can have of RNA drops can have an effect. So I don't know, Jenny. How are we going to evaluate that for people?
Well, what we got, I think we did talk to someone. I don't know what. We were in a conference call, and I remember the question came up, and the answer was that the white powder is an essence of the RNA drops. It's not the full effect of the RNA drops, which is true because the RNA drops have the probiotic effect. You've got all the amino acids and all those other things in, and the white powder is the white powder. So there's that distinguishing. So we came up with what is that? That there's no real comparison per se. You know, it's like saying how many peanuts are in a teaspoon of peanut butter. Well, you know, you can kind of guesstimate, but it doesn't really apply because there's so much more in the peanut butter, this kind of a thing. So we just have to leave it at. What we wanted to do by putting the RNA drops in the Restructure was just to really boost the effect of the protein itself, and I've gotten reports that that's exactly what's happening. So I think we're good with that.
So, yeah, let's say that it's the essence of RNA drops to help the digestibility of the protein in the Restructure. And as for the calcium, there's no calcium in Restructure. So I guess if you
there's 55. No, there's 55 milligrams.
Oh, okay. Okay. Then if you need 600 milligrams a day, that's really not much at all. So that's not a worry. In terms of a coronary calcium score, yeah, they're pushing those now. But as you can tell, even from the question, well, I have a coronary calcium score, so they want me to be on statins. I mean, where does that logic come in? You know, they just have the associated diseases and say, well, people have coronary calcium scores. They often have high cholesterol, so we'll give statins to prevent that. And then, you know, you have immediate side effects, which doctors they rarely acknowledge. So to get your coronary calcium score down, you take your Remag. And I think that answers that question, Ginny.
Yep, excellent, very good. I know it's hard to remember the whole question when I'm reading them. I think I'll have to slow down a little bit on that. Sorry about that. I'm reading the whole thing out. Okay, let's now, Pookie's mom sent in a question, but I'm going to ask you to address that off the air. Pookie's mom, if you're listening, I know you're very interested in this topic, but your question was very technical, and your daughter's condition is very specific, and I think it would be best if Carolyn just, you know, answered that privately. So we're going to proceed with that strategy. Okay, let's see. Let's go to another. Where are we here?
But you know, I do have some text that I clipped for Pookie's mom from the 2017 edition. If I can get my computer back, I have a whole thing about dialysis, and I think I already mentioned it a little bit that. One health practitioner who's on dialysis says that before her dialysis, her magnesium level is such and such, and after it's lower. So this is where Remag is very important to keep your magnesium levels up. And this health practitioner said that it keeps her from getting leg cramps and heart palpitations and helps her energy and helps with her sleep. And she said everybody on dialysis suffers from leg cramps and heart palpitations. So they're just totally stripping people of their magnesium with each dialysis treatment.
Okay, now did you already see Pookie's mom's email?
I did. I read it. I did.
Okay. All right. Very good. So that was your response. Okay. Very good. And did you respond to her difficulty seems to be how to get her enough?
Oh, right. Yes. How to take it. Well, that's, in food, somebody's giving it to their Down syndrome boy, puts it in his food, and he keeps demanding more and more. If she leaves it out just to see if he notices, he keeps demanding more and more food until she puts it in his food. So he's totally addicted to it. So you can put it in food. We are continuing to experiment with Remag capsules. So at some point that's going to be a possibility, but right now, just throw it into anything. Applesauce. If it's a cooked meal, just put it in after the meal cools down a bit. What do you think, Jenny? Is that what she was asking?
Well, she's kind of like saying, let me just read it to you. Okay, then. I've had difficulty trying to figure out how to supplement my daughter's diet. I do give her the Remag 3/4 of a capsule in the mornings, 40 minutes before breakfast on an empty stomach. She has to take 1,334 milligrams of calcium acetate with every meal to bind phosphorus, which I'm sure will interfere with the ability of calcium acetate to bind the phosphorus. Additionally, she's dealing with chronic constipation that requires the regular use of a 5 milligram Biscodyl, Biscodyl tablet, and suppositories along with saline enemies. This has only improved slightly since we started on the Remag in April. She stopped.
Well, Remag 3/4. let me interrupt. That's enough.
Okay.
3/4 teaspoon or cap of Remag is really not enough. And people who do get therapeutic amounts of Remag, their bowels do improve. It's not a laxative, but it helps make the intestinal muscles work properly. They're not tight, they're relaxed, they do their job to push waste matter out. So, I mean, someone on dialysis really needs 2 and 3 teaspoons of Remag. It does not have to be on an empty stomach at all. Yes, this calcium business, sheesh, they make it, worse and worse. And this is what I have in the Magnesium Miracle book. I talk about this woman who's on dialysis, on the Remite, etc. She's finding that she needs less and less of that calcium supplement to bind her phosphorus. The magnesium is doing the job. So, this extra calcium they're given just pushes out their magnesium even more. I mean, it's amazing how much lack of common sense there is in this dialysis world.
And what about Remite? She doesn't mention that she's taking any.
Yeah, that's going to be very important because all the minerals are going to be flushed out with every dialysis treatment, and they're not going to be measured. So absolutely, to help heal the kidneys, the Remite is very important.
Okay, very good.
And
all right.
And the Restructure would be a good food for her to take too.
Oh yeah, Restructure
okay.
would be fantastic. Absolutely. Yeah. And you can get Restructure in just a packet or 2. You don't have to order a big canister. So just get 1 or 2 packets. My fitness trainer loves putting it on his oatmeal every day. My brother started putting it on his cereal. Just, you can shake it on top of food and that kind of thing. She doesn't have to have a shake, and you don't have to go through all that. But Restructure would be amazing. Okay. Let's see. Okay, here's a new question. All right. Hi, Jenny, Dr. Dean. I had a heart attack with angioplasty 2 years ago. I've been on metoprolol, clopidogrel, 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 aspirin, and was originally on Crestor, but managed to talk my doctor into changing it to dry red yeast rice. I began taking Remag 6 months ago and Remite a month ago, but I have been taking it irregularly. Now for the past month, I'm taking them regularly at the lowest doses, and I've also ordered RNA drops and Realign, and will begin taking them according to your complement program. I've also been taking vitamins B, C, probiotic, ashwagandha, and chromium, 400 micrograms, with a cinnamon supplement because my blood sugar is going up to 110, and my GFR kidney test is 47. These were normal before my heart attack and subsequent medications. Do you know if side effects of any of these meds might be causing the sugar and kidney problems? Another question I have. Yes. Yes.
Well, let me answer that. That's a lot. Let me try to remember what she wants to know. So yes, you have a heart attack. You get put on a whole list of medications. They deplete your magnesium. You start getting high blood sugar because low magnesium is actually a sign of diabetes. You start getting all kinds of magnesium deficiency symptoms, and yes, that's what's going on. Chromium is in the Remite. All you have to do is look at the label on the website, and you can see chromium in there. Read the Remag book, the Remite book, even the AFib book. You don't have atrial fibrillation, but the AFib book is very good for anyone with heart disease to show what happens when you take these medications over time. You just get sicker and sicker. It's horribly obvious to me what's happening in medicine, and I do say it. I say, doctors do not think there's any cure for heart disease because they don't see anyone being cured. And they do not see that the drugs they're giving are causing the heart failure and the heart disease that is incurable. So it's a terrible bind that they're in, and they'll continue to ignore it because doctors really don't want to be hurting people, but they have nothing else to give except these medications. And even if you don't have high cholesterol, they'll try to give you Lipitor or Crestor, and then you'll have side effects. What else? Was there anything else she asked that I haven't answered?
Yeah, she did say, and you said about the Remite having chromium. She said that she knows that the Realign has the B vitamins, and then she just said, I would appreciate any other advice on what other supplements besides your complement program you feel would be beneficial for me.
Well, that I've covered in a blog called Dr. Dean Supplement Recommendations. I have it under resources on my website as well. What I think people could benefit from besides the complement formulas, and I go through everything. Actually, I might not have Restructure up there. I better update that blog. And it's basically just adding Blue Ice Royal, which is your vitamin A, D, and K in food sources. Yeah, it's fermented cod liver oil and butter oil. And I don't know if I read it out yet. I don't think so. Somebody over in Sweden or Finland whose vitamin D levels were low and didn't think that the Blue Ice Royal would help because he didn't even know the potency he was taking. And he even said, I agree with everything you've said, but I didn't agree with you there. So he did his experiment. He had his vitamin D tested. He took Blue Ice Royal for, I think, 3 months, and along with his Remag, his Blue Ice Royal brought his vitamin D levels up to, very good acceptable levels. So Blue Ice Royal works. And I don't know, probiotic, Prescript Assist, and, ashwagandha, that's like a tonic, for energy and whatnot. I think it probably works because it can be high in magnesium. So I just tell people, look, spend your money on Remag and don't worry about taking all these tonics, which, most people tell me, yeah, I take it. I don't really feel anything from it, but it's supposed to be good for you. So that's, my thesis about supplements is, take them if they work for you. And if they don't, then find something that works. And fortunately, complement formulas seem to work for most everybody that takes them. Over to you, Ginny.
Very good. Excellent. 602-666-6027 is the number to call to talk with Dr. Dean this evening. You have to hit *5 on your keypad if you'd like to get into the studio. 602-666-6027. Again, if you're listening, *5 on your keypad will raise your hand in the studio and let me know that you have a question or comment, and I'll put you on the line with Dr. Dean. In the meantime, we continue to press on with our important schedule of answering all these questions that keep coming in. And Pookie's mom said, thank you for addressing this. I have heard your suggestions. I will keep you apprised of her situation. So very good. Thank you, Pookie's mom. We appreciate that. Okay. Margaret is also typing in, hello, Carolyn, Ginny, and Bob. I have a friend here with me, and she wants to know if, since she's on blood thinners, if she can take Remite, Realign. Would the protocol be different than what the normal protocol is? Also, she has major sinus problems from nasal passages to ears. Been going on for years with all kinds of testing. She has major sinus problems from nasal passages to ears. What do you think that means?
Yeah, when your ear holes seem to be connected to your nose hole at some point.
Okay.
You get clogged up. But anyway, okay, what do we got? Blood thinner and sinus. So, blood thinners, there's no side effects, no problems with taking the Completement formulas with blood thinners. The Completement formulas, you just might as well say they're food. And they're the nutrients you don't get in your food anymore. So we've had no problems with people taking any amount of drugs with our Completement formulas, and that what they find is their symptoms improve so much on the Completement formulas, they're often able to wean off drugs. Now with blood thinners, I don't know why your friends on blood thinners, some people have had a leg blood clot in their life and are told to take blood thinners for the rest of their life. But when you look at the history of why they got a leg blood clot, it's from dehydration, being in a plane for 10 hours. There's a known reason for it, and that's why I tell people, hydrate for Pete's sakes. Drink enough water and put your sea salt in your water. Take your Remite so your cells are hydrated and you don't develop a lot of conditions because you're dehydrated. The edema in people's legs is because their cells aren't mineralized and aren't hydrated. So you really have to pay attention to that. As I said, doctors, you've had one episode of a blood clot in your leg, and then they tell you have to take blood thinners forever. In the AFib book, I talk about using nattokinase or serrapeptidase as more natural blood thinners that they use in Japan. As for sinuses, usually sinuses are yeast. They're fungal. The Mayo Clinic did a study and said that 97% of sinus infections are fungal related. And that gets to the yeast detox. And Margaret, if it's our Margaret and Bill, Margaret knows about yeast detox and can talk to her friend about that. And also using a neti pot. A neti pot is a saline liquid with 1 drop of tea tree oil, and you run that through one of your nostrils, and the liquid comes out the other nostril, and it gets that tea tree oil into the sinus cavities to hopefully treat anything that's an infection. The problem with sinus infections is that there's no blood circulation deep into that mucus ball in your sinuses. The blood vessels are along the walls of the sinuses, and they're not going to get antibiotics to that mass of mucus in your sinus cavities, so you have to wash it out. And chronic sinus infections just get people into years and years of antibiotics and yeast overgrowth, and then the symptoms never go away because antibiotics cause more yeast overgrowth. So there.
Excellent comprehensive answer. Thank you, Carolyn. Very, very good. Okay.
Yeah, I do better without my computer in front of me. I'm just looking out at the scenery and just chatting away.
Just looking it out. Okay, now here's a kind of off topic, but still a good question. I think everybody would like to know the answer to this question. Would you give your thoughts on the cause and perhaps a remedy for cherry angiomas? No. I have them, and I can't get rid of them, so I have no cure for cherry angiomas. I call them my daddy spots because my father used to have them, and I have them. So I have no. Some people say it's liver disease. Who knows? It's capillary hemangiomas. They're just little red spots, but. No, I've been searching for a cure, and I have not found it. All right. Now, she wanted to know about the underlying cause, which you're not going to, we already talked about that. But also she said, Also, have you heard of colloidal copper? And if so, your comments on this supplement would be appreciated.
No, I have not. No, I have not. I just, in our remite, we have the picometer copper in a small amount. There's a lot of concern lately about too much copper, with all the copper plumbing, copper IUDs, low zinc in our diet. People seem to be, some people are overloaded with copper. There's a big hue and cry about copper now, but I know people need some good copper, so I put a little bit of copper in the remite. I wouldn't work with colloidal copper. I mean, the beauty of the remite is that there are 12 minerals in there. They're low potency, they're picometer, they're well absorbed, they do their job, and that's all you need for your multiple minerals. You don't have to take individual minerals and try to figure out how much to take.
Okay, very good. Excellent, excellent. Okay, let's see. Oh, that's a long, long question. I won't do that one. Too much to read. Okay, here's from Australia. All right. In August, I had 2 intensely painful renal colic attacks, with the second trip to the ER resulting in a stent placement. 2 days later, I had a simple fall at home and fractured my pelvis. 10 days later, I had laser surgery to break up a kidney stone. I removed the stent myself as I couldn't make it to the bathroom in time with it in. I was on crutches. Oh, dear. I'm now having surgery this Friday to remove a large parathyroid adenoma, which seems to be the culprit messing with my calcium levels. I'm also having a partial thyroidectomy to remove a possible cancerous growth per an ultrasound. I have been taking Remag, Remite, and Realign for over a year, and I love it. I originally began your protocol because of restless leg syndrome, heart palpitations, and a desire for overall heart improvement. It has worked, but now I'm wondering if I should make any changes in my supplementation after my surgery, as my calcium levels are now supposed to be normal.
No, not really. I've become much more aware of parathyroid tumors. They're benign, non-cancerous tumors that can throw your calcium out of balance. And and I don't know if I consulted with this person or not, but there have been a few people who've told me, I'm on the complete formulas, but I still am having problems. And I think we've talked about it on the show, and I've certainly written about it in my 2017 book, that you have, if you still have symptoms on the completement formula, symptoms that imply high levels of calcium, and certainly kidney stones is one, and fracturing your bones is another, because when you have too much calcium, your bones can get brittle. So when that happens, you get your ionized calcium levels. If they're even slightly high, you get ultrasounds and have your doctors look for parathyroid tumors, these little benign kind of nodules on your parathyroids. It's a bit intricate, but it is important to cover that aspect of overcalcification. So I'm glad this was brought up. And I know I'm not making complete sense, but I think I've blogged about it. So just look up, Google my name and parathyroid and get the information. I know the clinic in Florida that does the parathyroid nodule resection. I think their website is just parathyroid.com, and they have a lot of amazing information. There you go, Ginny.
Yes, and actually in our blog, if you go to the blog.rnareset.com and type in parathyroid, you will get a archive of the April 25th, 2016 show, in which Carolyn did an amazing job laying out this whole situation and providing a lot of resources to that show. That's one of our favorite archives to provide for people. So that is something we recommend as well. Okay, excellent. So 602-666-6027. Again, *5 on your keypad if you want to talk to Dr. Dean. Raise your hand in the studio and let us know you have a question or comment. Joan's on the chat line, Carolyn, and types in, Dear Dr. Dean, would Renew work for gum problems, and what do you suggest for varicose veins?
Yeah, we've had people rub Renew on their gum line. I mean, with gum problems, it sounds kind of simplistic, but flossing is very important for gum problems. That's where they start, when you get a buildup of plaque on your teeth near the gum line. So flossing and, rub-in Renew is fine. For varicose veins, depends on the size. I mean, for small veins, it's getting your bioflavonoids. So that's where in my blog, Dr. Dean Supplement Recommendations, I talk about making your own rose hip liposomal vitamin C, and the rose hips will have the bioflavonoids. We've had people who've had breakage of blood vessels in their eyes, which I've wondered if it was bioflavonoid deficiency, and they took food-based vitamin C, and their eye capillaries healed up. Beyond small capillaries, then it's sclerotherapy, where saline is injected. Usually it's just saline injected at various sites along a varicose vein to collapse it. And I think that's a safe procedure. I knew a doctor in Quebec who did that and has clinics all over. So sclerotherapy for varicose vein treatment. And I think in my Future Health Now encyclopedia, I have a section on varicose veins. I mean, probably talk about witch hazel and getting your exercise, maybe doing lymphatic massages, that sort of thing. So that's enough. That's enough for that, Ginny.
Okay, very good. I'm going to look and see if there is anything. Yes, varicose veins in your Future Health Now, and you do say all those things, and you give a little homeopathy too.
Right.
Yeah, so you can email me at support, SUPPORT, RNA Reset, and I'll send you the excerpt from the Future Health Now encyclopedia. But it is a reinforcement of what Carolyn just said verbally over the radio. Okay, let's go to this question from Mitzi in New Jersey. I think she's listening tonight. Mitzi, if you want to talk with Dr. Dean, you can just hit *5 on your keypad. That might be equally effective if you're able to do that. But if not, maybe you're distracted or you have something else going on, then I will read your question and we'll get your question answered. Okay, let's see. Here we go. She says, Hi, Dr. Dean. I've written to you previously about this problem. It's getting worse, and I would like to know what I can do to help it. I am almost 90. I am taking your complement formulas, 2.5 teaspoons of Remag, 1 3/4 teaspoons of Remite, 2 Realign in divided doses. I have just increased my RNA drops to 5 drops 2 times a day. I am 95% gluten-free, and I just started eliminating the nightshade vegetables. I am very active. I just came home from Tai Chi class. I feel that I am so diligent in trying to get better, but it doesn't seem to be working. I have peripheral neuropathy. Lord, I have peripheral neuropathy, which also seems to be worsening. Not to forget to mention that I have AFib as well. I'm just continuing my daily routine and thinking positively that things will get better down the road. Thank you for any input you might have for me. Kind regards, Mitzi.
Yes, I answered that already because Mitzi's a long-time customer. I think we met her in up in, where did we? Chicago, didn't we, Ginny?
I don't know. We might have.
Right. And anyway, what I said was, the Restructure may help with the protein and, healing. But then I said, I applauded her for still keeping, hanging in there and demanding to be better. And, I think she's a lot improved, but what I did do in her email was send her what arthritis means in total biology, what the conflict is in arthritis. And it is related to overworking, overworrying, trying to put the family first, devaluing yourself, and that creates like a bit of a roller coaster. It's kind of hard to explain, but what happens in the biology of the body is you push and push and push to get something done for someone else, or even worrying about someone else. And when Mitzi has children, grandchildren, so it goes with the territory. So you worry about someone else, and then the stress is relieved. Well, in the stress relief phase, according to total biology, that's where the joints will act up and the arthritis will act up. It's called a healing phase. Now, it would be fine if a person could rest through the healing phase and just completely heal. But usually what happens is the next crisis comes up, the next stress, the next conflict, and then that just stirs everything up again. It kind of gets your adrenaline going, the adrenaline and the cortisol from stress sort of take care of the aches and pains for a while, and you think, oh, okay, I'm getting better. And then the stress is over and you go through a healing reaction and your symptoms come up. So I don't know what to do about that type of arthritis where, a person, especially a woman who has a extended family can't just stop thinking about them. You can't just go on a desert island and heal those, kind of roller coaster conflict and healing phases. And I don't know if that made any sense, Ginny, but just for Mitzi to know, I mean, this is what the body goes through. Constant sort of irritation, aggravation, healing, and maybe just knowing that, oh, okay, then I'm just going through another phase, and just try to detach a little bit more from it so that, she's not so wrapped up in thinking, well, I'm not getting any better and it's not working. And then you kind of blame yourself or create another conflict or stress because you, as Mitzi said, I'm doing everything I can, and she is. She's even taking the right amounts of everything, and she's still not getting better. But it's what life throws at us. Worrying and then relaxing, worrying and relaxing will have an effect on the body. Bob, what do you...
I think I have something to say.
I heard you click in.
T.S. Eliot said old people should be explorers. Start exploring, start probing, start listening to Payday. Hear Ion tell you're never going to die. You can't die. Get a different context. Otherwise, you're a bloody neurotic, and let's face it. People who are trapped in their thinking patterns are immature, no matter how old they are. They haven't realized the value of thinking out of things or into new things. So who cares how much you love people, care people? You got to figure out how to get your mind operating harmoniously. That's a key to health that nobody emphasizes, not even Dr. Bean.
My name is not Dr. Bean.
Whatever.
Oh, dear.
Dr.
Right.
Bean is
That's bad, Bob.
See, look, I don't care what other computer distractor. I just see a gap I can plunge into here. But you have to compliment Carolyn. She's sitting here saying all this stuff with nothing to look at. This is like endless tape recordings coming out of Carolyn.
The unexamined mind.
The unexamined doctor is not worth attending.
Okay, mute yourself, Bob.
Yeah,
I
thought I'd be a computer. Okay. We didn't.
Okay, I think we have a couple of phone calls, Carolyn. I just want to finish and say, what do you think about also, Dr. Holt, if somebody is stressing out about these things and can't stop, doing some total biology work with him can be helpful maybe?
It can be. I mean, you have to want to do something like that. Like Bob's saying, examine, you kind of get a detachment from the physical and ask the why of things. Ion wouldn't agree, I'm sure, but there is a consultant that I refer to. I don't do total biology consulting, but I just I know enough about it that I know that disease symptoms are the body's way of staying alive. They're a biological reaction to stress and conflict, and I really believe that. And when things get a bit complex, you'll hear me go into total biology when it's not just the physical symptoms that a person is working with. If it were just physical, then complement formulas would be doing more. That's how confident we are about them. But I don't have Dr. Holt's number, email, or anything in front of me. Or is it? Turnpoint Health.
Turnpoint Health. Yeah.
Yeah. .com.
Yeah, you can look there. Okay, very good. All right, a couple of phone callers, Carolyn. Let's try to take these before the show wraps up. With about, let's look at the studio clock, 11:52 left in the show. Let's go to area code 727. You're on the line with Dr. Carolyn Dean. If you could state your name and then your question or comment.
Well, good evening. George speaking, and I called maybe about 2 months ago, and Dr. Dean was kind enough to refer me to the Norman Clinic here in Tampa Bay area. Hi. I'm happy to report that they said that there's no parathyroid tumor. And
good.
Yeah, which I guess is good news and still leaves me with something. But the calcium ionized is 5.3. The PTH intact in calcium, 9.8. And the parathyroid hormone intact is 43. So he said, from a parathyroid viewpoint, you're in good shape.
Oh, that's good. Well, that's good that you went to it because, even that calcium level seems a bit high. But if they checked you out, they're the best. George is talking about the parathyroid.com people is it Tampa Bay or just Tampa, Florida?
Yeah, Tampa. Actually, Tampa. And they are really great. I just want to, thank you for that because they were just so amazing and very caring and all over it and did a lot of work and didn't charge up for, like there was no charge until they got their test results back. So they were great all the way around.
Oh, that's wonderful. And what are your symptoms then remaining? Because, I guess I just wanted to make sure that wasn't a problem. And, I'm glad it wasn't. But like you said, it still leaves you with symptoms, correct?
Yeah. Well, I've been on a 4-year search for hypertension and like 160 over 105, and that's what began my health search. And during that, I was diagnosed with osteopenia. And I had calcium or kidney stones and gallbladder stones and now bone spurs in my neck. So the Norman folks said, you definitely have a calcium problem, but it's not by parathyroid. So that's where I'm kind of at right now. I'm just wondering what your thoughts are.
Okay. So how much Remag are you taking?
They told me to come off it about 2.5 weeks ago, and all supplements so they can get a good flat read on it. So right now, presently, I'm not doing anything.
Right. So, from what I've talked about, I don't know if you listened to the whole show, George, but with calcification, it's a matter of getting enough magnesium to dissolve the extra calcium. So I'd say get on the Remag and, real therapeutic doses or work up to therapeutic doses and see what that does, because we've had a lot of people tell us that it helps their blood pressure, it helps decrease their calcification. So that would be what I would do.
I hear it over and over and over again. So now that we know it's not a tumor or anything like that, I think I'll load up. I'm about 6'2" and 235 pounds. What would you recommend for a therapeutic?
Well, you're looking at 3 and 4 teaspoons, work up to that, and then with that amount of magnesium, it is important to do your sea salt in the drinking water and remite at about 2 teaspoons.
At 2 teaspoons. Perfect.
Yeah.
Well, good. Well, I hope to come back in a month or 2 or 3 and report some great news to you.
That'd be excellent, and I appreciate you following through. It's difficult on the show like this to just say to someone who had all the symptoms you did, oh yeah, just take Remag, without really being thorough about the parathyroids. And it's great because your call comes after the email from Australia where someone was talking about her parathyroid, and she had a parathyroid problem. So I appreciate that. It brings things full circle. Thank you.
Yeah, and thank you for really being completely responsible and pointing me in the right direction, making sure that we're on the right course. So thank you. I appreciate it.
Okay, great, George. Well, we'll talk to you in another couple months then.
Great, thank you.
All right, excellent. And let's go to area code 703, the great state of Virginia. You're on the line with Dr. Carolyn Dean. If you could give us your name and then state your question or comment.
Awesome. Hey, my name is Greg, and I just started taking the Remag and the Remite, and I'm actually a NASA engineer, so I don't have any real medical background or training or anything else. But it sort of helps me to understand how this works. So my question was, I had always, been aware of health issues and nutrition and things like that, and I'm, by the way, so far great results with the product. No issues there at all. I think it solved my heart palpitations, and things are really good. I'm just curious, we drink, my wife gets, reverse osmosis water, and I'm just thinking about the form of the minerals and what is it about Remag and Remite. And I'd always had learned and understood that with minerals you need to have them chelated in order to get into your system.
Right.
And this is
I
sort
get
of
enough
a different approach.
I get enough to go on.
Okay.
When the minerals come from plants, which is how we're supposed to get our minerals, or from water, but it's more the plants. In order for them to be taken up in the plant rootlets, they have to be picometer in size. Once they're in the plant, in order to go up the stem, etc., and be utilized by the plant, they are chelated in the plant. So vitamins and mineral
we're getting minerals from plants in a chelated form in our food, typically.
That's right, exactly. So when mineral companies decided to make minerals to sell, they say, oh, plants chelated. Okay, we'll chelate it, and then it'll be better. But what happens is they chelate non-picometer size minerals. So right away, it's got nothing to do with the plants. And then, like I say in my books and writing, there are no more minerals in the soil. They've all been depleted unless your farmer uses rock dust. So
yeah, I'm actually a part-time farmer, so I've got interesting things on that front, but that's a whole other conversation. Go ahead.
Right, very good. So So then when you're chelating a rock mineral that's not picometer in size, then the body just has to do extra work to break it down, with stomach acid, etc. So what the chemist and manufacturer did with the magnesium chloride, that's the base of the Remag, is they were able, by a proprietary process, to make the magnesium in a stabilized form. when you put magnesium chloride in water, it will disassociate naturally. That's what it does.
It'll put into ions, right?
Yeah, into ions. But what happens is every millisecond they're binding back up. They're releasing binding, releasing binding. There's something about this process where the magnesium ion and the chloride ion too are stabilized so that there's a sufficient, supposedly, time for the magnesium ion to be absorbed into the cells. And it turns out that the mineral ion channels of the cells are picometer in size. So this breaking the magnesium chloride down first, then stabilizing the ions, gets it to a picometer size, stabilized, so it's sucked right into the cell through this mineral ion channels. And, on a personal level, any magnesium I tried before Remag just caused a laxative effect, so I knew it wasn't being absorbed. It was just going straight through me. So it's a proprietary process.
Yeah, how did you find out about this process? I guess just there's companies out there that are involved in this, and it's interesting.
Yeah, it is very interesting. Years ago, when I realized I had the laxative effect, I tried to find non-laxative magnesium, and I found an angstrom process, but they were only producing magnesium at 45 parts per million. I've got my Remag up to 60,000 parts per million. And I tried to get, for years I tried to get mineral companies, established mineral companies to research a non-laxative form. And they said it was too expensive, required too much public education, but I just kept at it and just finally found someone who could do it. And there are ionic magnesiums out there, but they're not, they're just putting magnesium in liquid and saying it's ionic. They don't have this stabilizing process. So, that's all I know about it. And the manufacturer's, his statement is on our website under the info link if you want to read some more of his words.
Oh, excellent. And I was the other thing that I've been pondering is, the nutrition in the soil and the minerals, and I understand all that and why we're deficient in so many minerals. And my wife is, she's very aware of toxins and doesn't want to drink, any tap water or anything else. We have a well, and I'm like, and I'm thinking the water where it is demineralized, essentially.
Excuse me,
I'm sorry. Yeah, Greg. It's the end of the show. It's a good question. We'll take it up next week, okay?
Oh, good. I'll dial in next week. Thank you so much. I so appreciate it.
Okay, bye. Take care. Thank you, Bob. Thank you, Bill. Thank you, Ginny. Thank you, callers and listeners.
Thank you, Ginny.
Thank you, everybody.
Thank you, computer.
AchieveRadio.com. Psychic radio, holistic radio, spiritual radio. This is AchieveRadio.com. Follow us on Twitter at twitter.com/AchieveRadio.
Very, very, very good. For we are eternally, completely, deliciously, forever a great big old tomcat. When it's much more simple than that. You have a physical body. Your physical breathing, blood pumping, mucus creating physicality that has access